Hi, my name's Andy Goldberg. I'm a medical doctor, an orthopaedic surgeon, and a father to 3 young kids. And just like you, scared around this whole COVID pandemic. More than 1 million people a year attend the emergency room with a severe ankle sprain. Hundreds of millions more would have sprained their ankles but never sought help. It affects celebrities, athletes, and to be honest, most of us would have rolled our ankles at least once. What happens when you roll your ankle? So the ankle is stabilised by strong ligaments, and these hold the bones together. And if you think of the ligaments a bit like an elastic band, when you stretch an elastic band, it goes back to its normal shape. But if you overstretch it, sometimes it stops acting like an elastic band, or it can even rip apart. And that is what is an ankle sprain. We tend to grade these as grade 1, where they're stretched a little bit, a few fibres tear, grade 2, where you tear a lot more of the fibres, and grade 3, where they tear in half, like a torn elastic band. A grade 3 injury is often very swollen and bruised like this, and is the most serious. What would make you go to the emergency room?
So you've rolled your ankle. If it pops, if it swells immediately, and it's really painful, I think you need to go to hospital. It's time for an x-ray.
That's great, Matt, but even if they go to A&E and have an x-ray and shows it's not broken, without an MRI scan, sometimes it's really hard to rule out a grade 3 ankle sprain, which in my opinion is often worse or more serious than a simple crack of the bone. So how can someone watching this video know if they've got a grade 3 injury? Well, it's difficult even for an expert. So my advice is that if it looks like this with bad bruising, it's swollen and it's painful to weight bear, then I would treat it like a grade 3 injury and I'd recommend you wear an ankle brace. It's possible there are other things that you could have done, like broken the bones on the outside, called the fifth metatarsal, or injured some of the tendons, like the peroneal tendons on the outside. You may have even damaged the articular cartilage inside the ankle, called an osteochondral injury. And all of these things really need a diagnosis, so I'd recommend, if that's the case, you seek expert advice. Thank you for watching. We'd love to hear your comments and suggestions for new videos. Please don't forget to like and subscribe.